Good morning, good afternoon, good night. It depends on where you are. How are you doing? I trust that you are healthy, that you're well, that you're safe. Welcome back to my channel. My name is Sophia Elizabeth Lambert. I'm a published author of two books titled Hope Deferred and Rise Up Mentoring Boys to Become Men of Integrity. I have been doing a series on mentoring boys, and today I continue with the series. This is season two with a very special guest. He is Dr. Shane Brown, and we're talking today on just excellent how men and boys should have excellent health. It is said that the male lifespan is shorter than females because they are more likely to smoke, drink excessively, and be overweight. They are also less likely to seek medical help early, and if diagnosed with a disease, they are more likely to be non adherent to treatment. Their life is also shortened because they are more likely to take life threatening risk and die in car accidents or fights or gun violence. It is on those premises that I am having this discussion with Dr. Brown today. Dr. O'Shane, I beg your pardon, Dr. O'Shane Brown, MD, is originally from Portmore, Jamaica, where he completed his secondary studies at Kingston, Jamaica, following which he moved to the United States to pursue a future in medicine. He went on to complete his Bachelor of Science in Biology and Master of Biomedical Sciences at Florida Atlantic University. He then attended and completed his Doctor of Medicine degree at the University of South Florida before ultimately performing his 3 year residency training in internal medicine at Bazaar Health Network in Phoenix, Arizona. Did I pronounce that school properly, Dr. Brown?
It was Abrazo Health Network. Yep.
Okay, great. Thank you for joining me. Welcome.
It's good to be with you today. Happy to be here to share in such an important topic.
Thanks a lot. So, Dr. Brown, as I read, they are males generally have a shorter lifespan than females. In your practice, do you find that younger men die more frequently than younger women from heart attacks and any other disease?
Well, I think what you do notice, what you do notice most naturally is that men do tend to be delayed in their initial experience with the healthcare industry.
Oh,
Most men usually wait until a later age to usually seek out like healthcare often. Um, a lot of the times, either they need to be pushed to do so, or there needs to be a causative incident for them to usually kind of seek out any kind of healthcare. Um, Women are certainly, from my experience, more likely to be involved in more regularly scheduled approaches to doctors and kind of seeking out preventative care compared to men.
oh, okay. So, do you have any idea what is the reason for the delay? Why is it that is it fair? Is it that if they should find that something is wrong, that they would just
Well,
do?
it's difficult to say exactly, but I believe in general, you know, us men tend to have we usually tend to kind of believe that believe that we're doing well. Unless there is something that kind of tells us that we're not feeling well, we usually are less inclined to um we always usually believe that we're in the best of health. We usually kind of like are a little bit more prone to take risk as well, in both in our normal lives and also eventually sometimes because we almost feel invulnerable. We don't usually anticipate the worst case scenario at times. I can even use my own personal self. I've obviously been involved in kind of medical training or sciences from a young age. But even as myself, I went a long time without really seeking out a doctor until I really started my residency training. And then I was like, I'm preaching this message to others, but even myself, I kind of took it for granted that I need to get regular checkups to make sure my own health is in order. So, even myself, who is educated on these issues, you know, took it for granted that I'm in the best of health without really doing these regular checks. So it's not surprising that even someone who may was not really gone through those professional training themselves will kind of have that same kind of mentality. Um, so I think it's definitely in a psychosocial aspect with us men that we probably kind of view the world and our own like I guess mortality in that manner.
Okay, it sounds like a situation of a Superman.
Yeah, I guess you could call it like a Superman syndrome where we all just assume that we don't want to face our own, vulnerability. And so we just naturally expect that we're always going to be in the best of health. The unfortunate thing is, I think this platform and this kind of topic is important because, as a medical provider, you do recognize and you try to express the point that, it's always easier to prevent some of these health issues if the person gets regular checkups and these things are identified early, as opposed to trying to manage them or cure them later on once the issue has already kind of arisen. So I think that's why we need to stress that it is very important that both men and female, but especially young men, recognize that kind of establishing with a primary care doctor and having at least a once a year visit to get basic lab work, a basic physical exam, at least once a year to kind of make sure we can identify any of these potential chronic illnesses like diabetes, high cholesterol, high blood pressure. Those are things that we can kind of, catch early if there's an issue or signs that they could be an issue down the road that we could, start reducing those risk factors early and a lot of times prevent them from occurring in the first place. Um, we can also obviously, you mentioned earlier, a great point, men tending to be more common in terms of smoking or drinking alcoholic beverages in a higher quantity. If you don't see a doctor, a lot of times you won't even recognize just how much of a risk factor those are for some of these chronic diseases. And maybe hearing it from a medical professional can kind of explain to you the just how common these things lead to problems down the road, may prevent you from kind of indulging in them in a dangerous fashion. You know.
One of the things you mentioned, Dr. Bone, is the high blood pressure. Can you, for a man or a young man who is unaware of the causes, what is it that influences the blood pressure to, for them to get to that stage of having a high blood pressure problem? Or what's the
Yeah.
correct?
So for in terms of hypertension or high blood pressure, there are definitely two factors. There is a genetic component, so there is oftentimes a familial aspect which puts you at increased risk, and then there is a kind of nature aspect in terms of managing risk factors. Those include obviously high salt intake. By limiting the amount of salt in your diet, you can reduce that risk of developing high blood pressure. That means a lot of times food comes with salt naturally. And so we should limit the amount of additional salt we, use in our cooking as much as possible. Um, things Smoking is a risk factor for development of high blood pressure down the road, and also alcohol, actually excessive alcohol. The American Heart Association allows, um, at least says, men can have up to two alcoholic beverages daily, so that equivalents to about 14 drinks, and that a week, and that is not considered excessive. So in moderation, like we always say, moderation is fine. And when we say an alcoholic beverage, that means a 12-ounce beer versus a 1 ounce of cocktail, meaning if you're using like rum or something, that would be 1 ounce. And for wine, it's 4 ounces. So, you know, those are, obviously some people say two drinks and they're drinking a very large beverage. And so you have to recognize that there are very specific quantities that relates to that, and not take advantage of that to, fool yourself into think you're not drinking excessively. So smoking, drinking, and certainly salt intake are probably three of the biggest natural risk factors that we can control to limit our risk of high blood pressure in the future. But as I mentioned, there is a genetic component, and if blood pressure does run in your family, then you especially want to limit the secondary risk factors to reduce that risk of developing blood pressure as much as possible.
Okay, that's some very great tips, Dr. Bone. What would you say are some of the things to avoid as it relates to preventing their cholesterol level to increase?
So the with cholesterol, I mean that the two major factors, obviously diet. Very similarly, we want to limit or bad carbs as much as possible. So
What
that
are
means
those?
So that means, we want to limit our white rice, or heavy bread. So your white bread, some of the other like rye. We want to obviously, if you're going to eat rice, probably do brown. If you're going to do bread, maybe you would like to do wheat. Old grain would be preferred as well. Um, we obviously want to limit our fatty foods, so fast food, anything really greasy. So if you're making like chicken, you'd rather it be baked, grilled, as opposed to fried. We obviously, a lot, if you're cooking with oil, something like virgin olive oil would be a preferred option as opposed to maybe vegetable oil. So that's those are kind of dietary changes you can make to limit your risk of having high cholesterol. Similar to high blood pressure, there is genetic component as well. So if that is something that runs in a family, those secondary factors, minimizing them as much as possible, again, becomes very, very important. Um, so these aspects are reasons why you do want to get at least a checkup once a year. If you're seeing a doctor, they'll be measuring your blood pressure. When you come in for your visit, your a normal blood pressure is considered a that blood pressure is usually a top number and a bottom number. That we want that top number less than 140. Normal is considered 120 to 140. And that bottom number, we want less than 90. So your doctor is going to be measuring that blood pressure. If it's obviously above those ideal numbers, they will say, hey, let's kind of watch it. Let's have you measure it at home. Let's see if it's consistently elevated. They'll bring you back into the office, check it again. We don't usually diagnose blood pressure until we see at least two readings separated by at least a week. There are times where people get a little anxious coming into the doctor, they're a little worried, and that in itself can cause your blood pressure to go up. So that is why you at least want that once a year visit. We can check that blood pressure, making sure you're not showing signs of developing high blood pressure, where at that point we would kind of let you know we want to kind of manage some of these risk factors, and we'll ask you questions to make sure you're doing the right things from a diet standpoint. And you want to get blood work labs at least once a year. We can check those cholesterol, making sure they're within the range, and we don't need to kind of either consider changes in the diet or to consider medications early to prevent it from getting to a worse point. Um, Same thing with diabetes. You're going to get blood work, which shows how your blood sugars are doing. And a lot of times we can catch people in an where they may be getting close to that, and we can actually prevent them from developing diabetes by either getting them on, medication early, or we can say, hey, let's limit some of the sugars, the carbs, and a lot of times they can, lose some weight. Weight loss is always if we're not at ideal weight, that in itself is a risk factor for most of these things: diabetes, high blood pressure, and high cholesterol. So exercise is important. The American Heart Association recommends at least 150 minutes of moderate intensity exercise, cardiovascular exercise. That means, walking, a brisk walk, running, if you're able, um, you know, those things, at least 150 minutes a week, in order to promote good cardiovascular health.
Okay, we have been going through a pandemic. Have you seen an increase as it relates to depression and the suicidal ideation coming into the to where you practice? I know that those are some of the things that men struggle with. They struggle with depression, and they have, especially our young boys, the suicide rate is high among our young men. So, have you seen any effect of it or an increase since the pandemic?
So from just my personal observation, I haven't really noticed any real direct correlation in terms of any direct increase in, like depression or really rates of suicide among, young men, at least in specific regard to the pandemic itself. So I have not personally seen that correlation myself. Um, as you said, in general, um, there have been some concerns about, the rate of kind of depression and suicide just in a general aspect increasing amongst the young male population. And, no one's done any actual official studies to really
Study?
identify why that is. We can certainly speculate that, maybe a lot of it is from, psychosocial aspects in terms of increasing kind of pressures, a lot of, societies, a lot of different aspects where men have to, young men are kind of facing, what, they're experiencing, kind of, they're not sure where their role, what their futures lie, a lot of, the economy, at times is up and down. So, certainly a lot of these psychosocial aspects may be playing a role in that. Um, but at least at this time, there haven't been any formal studies to really, where we can say, definitively what exactly is contributing to this. And I will say with the pandemic, it is,
Okay, I understand.
yeah, certainly putting added stress and on, everyone in general. It's going on for 2 years. A lot of people's lives have changed quite a bit.
Hmm. Okay, I understand. I'm just wondering if there is. I know there isn't any study that has been done as yet. But I was just wondering if there has been any observation, informal observation of it. But back to specific, specifically to medicine, have you even noticed, or how can you encourage some young men to take better health care as it relates to their respiratory system? I know that smoking can affect them, um, because a study I found says that these are some of the health risks that men face: heart disease, respiratory diseases, alcohol addiction, depression and suicide, accidental injuries, liver disease. diabetes, and among them you have flu and pneumonia, as well as cancer. So, because the flu and pneumonia and respiratory diseases have been listed among them, I thought that it would be a good idea or best to encourage our young men how to take care of themselves so that they can avoid some of these diseases in the later part of their lives.
Yeah. So obviously, yeah, the big one, right, at the end of the day is
So, any advice for them?
the big one at the end of the day is
Can you hear
smoking.
me?
Yep, I can hear you. You hearing me? Yeah, I'm hearing you. Um, so I would say, are you hearing me? Okay. So I would say the
Yes, I'm
major
hearing you now.
the major
Okay.
you know factor there in terms of respiratory health is smoking.
I am, yes.
Okay.
Mm-hmm.
So the major factor in terms of good respiratory health is smoking. Um, my simple advice is no amount of smoking is good. Just do not
Oh,
smoke.
that's the major one.
Yes.
Okay.
No amount of smoking is good. Like as I mentioned before, it not only increases your risk of respiratory illness, like as you mentioned, pneumonia, but it also risks your development of chronic respiratory diseases such as COPD, um, and pulmonary fibrotic scarring of the lung. A lot of times, these once you develop these chronic damage to the lung, it will never fully recover, even if you were to stop smoking later on. So the
Oh,
simple advice is do not smoke.
can you you mentioned COPD? What exactly is that?
So it stands for chronic obstructive pulmonary disease. So when you
Okay.
smoke,
Mm-hmm.
it causes damage to the airways, often causing the airways to become more constricted and making it difficult for air to get in and out of the lungs. So, the more we smoke, it's actually a progressive disease. So, the longer we do it, the more damage builds up, and the worse your lung function is, and the worse the symptoms are. Um, if the person does stop, a lot of times your symptoms can improve, but you will never really get back to where you were a
Prior
hundred
to.
percent.
Okay. Thank you. So, Dr. Bone, we do not have a lot of time left. In your final, what would be your final set of tips or for our young men and boys to have excellent health or to help them to live a little bit longer, to change the statistics? I There's a thing that I believe is that we can change future history today by the things that we do, and we can change our young men's future history today, because if they take better care of themselves today, then clearly it will impact them later on. So, what advice do you have for our young men that will help to get them on that trajectory?
So I think the main tips are one, don't underestimate the importance of getting a primary care doctor, someone you see at least once a year, and this should be done as early as possible. So if you're listening to this, you likely should be getting a primary care doctor right now, if you do not have one. Um, that you should be seeing them at least once a year to so they can check your vital signs, meaning your blood pressure, your heart rate. Um, they should be at least getting labs on you once a year so we can be screening for some of these chronic diseases early and addressing them in a timely manner. Um, and so that is number one. Prevention is always easier than cure. That's a very cliche statement, but it is an honest to good fact in healthcare. The earlier we identify problems or the potential for problems, the easier it is to address them. So that is my most important tip. Second is do not smoke. It is a risk factor for many of these chronic illnesses, along with many cancers. So do not smoke in any capacity. Third is obviously we we want to have moderation, especially in terms of alcohol use, and we want to practice good eating habits, like we discussed earlier, a good diet, and also a consistent exercise plan and weight management is also a major factor in reducing the risk of many of these illnesses. And then probably the final point is, as we briefly discussed in terms of kind of mental health, it is something that, especially in the male community, is looked on as, weakness or stigma. And it is something that you should not be ashamed to acknowledge if it is an issue. And you should minimal discuss it with your primary care doctor, and they themselves, if they think there are other resources that could help you, they would be happy to point you in that direction. And I would recommend being open to that, as once again, that is something that often, the earlier you recognize it and the earlier you address it, often will be much less of an issue down the road. you know um Many of us face it, unfortunately. A lot of times people just aren't willing to accept it out of fear that they may be looked down upon.
Thank you, Dr. Brown. Those were some excellent advice that you gave to our viewers. I want to tell you that I appreciate you taking the time and know that you're very busy. So I thank you for taking the time to just come and share with our viewers the importance of excellent health and how best to prevent. As you said, prevention is always better than cure. So thank you for joining me. And to my viewers, I want to tell you thanks a lot again for seeing these videos. Sorry for the noise. I have a little thing going on and off in the background. Thank you for viewing these videos, this series on mentoring boys to become men of integrity. I am encouraging us all to mentor a boy. Let's change his future history today. They are at risk in many ways and for different reasons, but we can always join with them and help them to choose better pathways, choose better lifestyles in order to benefit them in the latter years of their lives. Thank you again, and please look out for the next videos. Have a great day.